Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. Today we have a renowned gynecologist and obstetrician and a specialist in colposcopy and robotic surgery, and that is none other than Parimala Devi. She has set a Guinness World Record in screening the cervical cancer. And more than that, she has a concern for the women, and especially when women come in emergency with the shock and the loss of blood pressure and losing the blood in liters, and then losing the life is not correct. And that's how she has come today to explain to us what is ectopic pregnancy, why it occurs, and what is the remedy for that. Welcome, Dr. Parimala
Thank you,
Devi.
madam.
It's a
Thank
pleasure to have you with us because you are such a wonderful person and you make everybody's life so beautiful. And all the women who come to you with pregnancy, they always go very happily. So tell us, what is this ectopic pregnancy? Why the women have to be very, very concerned about it?
Thank you very much, madam. Once again, good morning to you and respectful pranams to the teacher who taught me ABCD of medical field. And it is always a pleasure to speak to you and spread the knowledge because more we speak to you, I just want to express this, we get rejuvenated. That's what I have understood in few of the episodes. The smile, the energy, and the way you take the topics, and in your this one channel, whatever we say, like YouTube channel, so much of knowledge in that actually. Gnana the Bandara, it's a treasure, we can say. I have told today some two people or something, just see that the YouTube channel. Don't see any other channel, younger to me. That you will get so much of knowledge like that I was telling. So once again, coming to the important topic, that is ectopic pregnancy. That ectopic pregnancy, the word itself says ectopic. It is not in a normal place. In English
Yes.
dictionary, if you see that, other than the normal place, something is there, that is ectopic. So outside the normal place. So pregnancy as such, we know that any couple, once they get married, they are wedlocked. The one part of our ritual of the life of the couple is to give birth to a baby. That is motherhood. So motherhood is one of the dream which any woman will be thinking, like she wants to give birth to her baby. Some are the other time after some period of this newly married life. When they are planning this, or when they are just having some good time just after the marriage with the blessings of all the elders and suddenly like she finds that she is having some cramp. Some of our period, sometimes it may be a regular period or it may not be a regular period. Many women will have 40 days period, 45 days period because of PCO or something. That time she might have forgotten her period date also because she is into a lot of the celebrations of marriage, going here, coming here, so many, and sometimes they will take a tablet and postpone their period also because they want to do some puja. These are all our sanskar and rituals in our country. So in that period, what happens? She might have conceived, but she has forgotten her period date, and suddenly her attention is drawn that she is not well. There is some cramping, some kind of discharge is happening. She will try to neglect it, but it will not leave because there is something going on in her body. So that is the time, like when they do the pregnancy test, or sometimes they may not do also. They will run and come to the hospital. Most of the time, they will usually report to odd time only because in the daytime
Due
they
to the
will
pain.
convince themselves, oh, it is nothing. I'm normal only, and there is something occupied by them because of their newly married life. But when it increases this pain, cramping, and some kind of uneasiness, when they come to the hospital, then usually a gynecologist who are attending doctor will ask them about their period date because they are newlywed, any contraception they are taking. Then when they do the test, it may be a weekly positive pregnancy test or it may be some pregnancy test itself. Then they'll be surprised because they say that we didn't have period only properly in our all these years. Then when we convince them, no, no, there is some pregnancy attempt, we'll do a ultrasonography and see whether this pregnancy is everything normal, then we will send you. When we do the scanning, the total Kulja Sim Sim, it opens up.
I know the
Kulja Sim
secret
Sim,
will come
because
out. Yeah.
yes, ultrasonography gives us a clear picture whether she may be pregnant, but that pregnancy is not staying in the
In a
normal place
normal
of uterus.
place.
Yeah, usually a pregnancy, how it happens, as we all know, it happens at the lateral part of the tube. Like there are two tubes in a uterus in the reproductive tract of women: uterus,
Okay.
cervix, her vaginal tube, and there are two tubes which connect her ovaries to the uterus. So here
Okay.
the sperm, when it enters through the sexual act, it will go and catch up with the one of the eggs here, the healthy
Hmm.
egg, and then once it is fertilized, it slowly travels and comes in that 1 week time or something, and comes and sits here as a small bruna, whatever the
Okay.
fertilized egg.
Okay.
But there,
Zygote. Hmm.
these tubes,
Hmm.
wherever this side it may be or this side, these tubes sometimes they may be infected, or it
Hmm.
may be addition, like she might be having some
There may be
infection.
blocked.
Tubes are
Blocked.
not motile, they should be mobile actually. The tubes will be
Okay.
always like peristalsis, how our intestine
Hmm.
also will be keep
Yeah.
moving.
So they're
Tubes
moving.
also are floating,
Moving.
floating in that
Hmm.
peritoneal cavity. And they have a
Hmm.
beautiful fimbria, like a
Hmm.
umbrella shaped end that will go and
Hmm.
catch up the pregnancy. It is very nice to see that
Hmm.
in our YouTube animation
Hmm. Hmm. Hmm.
teaching this one channels and all. When it catches up the egg, that it will get fertilized and comes and sits in the side. That is normal
Womb.
pregnancy. But
Hmm.
here, what has happened? For some reason, this tube may not be motile. This egg, instead of coming here and sitting, it gets stuck here.
Okay.
But this fallopian tube is hardly 4 mm or 5 mm, soft tube it is. And uterus
Hmm.
has got so much of space for expansion. So
It's
the
very roomy.
pregnancy has happened, but it starts getting dilated because it is increasing in its size. Pregnancy, the tube ruptures most of the time.
Ah.
So when
Oh.
tube ruptures, it is totally a vascular area. Actually,
Hmm.
our obstetrics field is a very bloody field, we say, because something
Yeah.
happens,
Yeah.
it's totally
Yes.
into the blood. This
Only
one will
bleeding.
just
Yeah.
open up. So because of that, she will torrentially bleed in the abdominal cavity. We
Hmm.
may find her when she comes to the hospital with her kith and kin. Totally, she is in shock,
Shock.
pale,
Hmm.
pulse rate has increased, and her
Hmm.
eyes
Blood
are
pressure is
almost
low.
pale, and their abdomen is distended, and there can be fall of blood pressure also. So
Oh.
these things are more confirmed in the sonology, and it's
Hmm.
such a dire emergency. Before we used to tell about appendix and all. Oh, appendix
Yes.
case.
Yes.
When we
Yes.
were studying and all,
Hmm.
appendix case. Immediately we have to keep them ready, whether male or female. Like this
Okay.
in females, it is something like a equivalent to this appendix. At least appendix will hold on for some time. There is not
Hmm.
much of a bleeding, but
Okay.
here it is a vascular area. She will
No, in
torrentially
appendix, it's more of an infection, but here it is the
bleed.
bleeding.
Bleeding. It's a
Hmm.
physiological process which has gone into the disaster. So there will
Yes.
be heavy
Yes.
bleeding. Bleeding may be just 300 ml, 500 ml, or it may be 1.5 liters, 2 liters. So it is
Okay.
immediate, the
Hmm.
teaming up of the surgeons, anesthetist, gynecology surgeon, and also the attenders agreeing and understanding this condition, because there
Hmm.
is not much of time for us.
Hmm.
We say like lot of, there is a golden hour for us,
Hmm.
that
Hmm.
1 minute of time or 1 hour of time in
Hmm.
postpartum hemorrhage. Here also the few minutes is treated as a golden time. In that
Hmm.
golden time, we have to see that the blood is arranged and the consent is taken for the surgery, and we have to shift her and keep her ready for the surgery, because she's just torrentially, she's bleeding inside.
Bleeding. Bleeding. Hmm.
Outside, nobody is making out, but inside she is bleeding. That is
Hmm.
very well made out in the sonology. So once she is taken to the operation theater, we have to suck out all the blood and the clots which is there in the total lower abdominal cavity and upper abdominal cavity. And then
Hmm.
we may have to, very sorrily, we have to sacrifice the tube. Because that tube,
Okay.
if it can we leave also, that is
Hmm.
salpingectomy. We say this process is
Okay.
salpingectomy. If we
Hmm.
leave this tube also, it will be a diseased tube. Before we
Yeah.
used to leave, when I was
Hmm.
studying my medical, this one degree of MS in
Hmm.
1986-87, we used to leave the tube, but
Hmm.
ectopic used to happen again in that tube.
Yeah, because
Ah,
if anything diseased or damaged tube kept,
yes,
again it is going to
yes,
recur. So
yes.
better to remove it. Yeah,
Yes, so we
that's a
started
good
removing
point.
because another tube will usually give rise to again healthy pregnancy, and she will have a
Hmm.
normal pregnancy. Of
Hmm.
course, the repetition of the ectopic pregnancy is there in another tube also, not to scare,
Okay.
but this attention also should be with them. So once
Okay.
this tube is removed, again she will be cleaned up, and blood transfusion, whatever she has lost, we will be giving, and will
Hmm.
make her normal. So why we
Hmm.
wanted to speak on this ectopic pregnancy, madam, as you said, was you were telling we should highlight on the conditions which a woman have to be very much aware, because
Yeah.
pregnancy she'll be aware, she will be
Yeah.
aware of the contraception, but this ectopic pregnancy and how dire emergency it is, people will not know. They'll be
Yeah.
very innocent couple, they will have just finished their education, they will be into
Yeah.
job, and they are married, and they are just spending their best part of the time.
Yeah. Parimala,
So that,
here I would like to interrupt and tell, it is like, if you don't look at the tip of the iceberg, like
yes,
Titanic ship, they will sink.
yes,
So they are very happy,
they
they
may
are
immerse.
enjoying, everything is all right. But
Yes,
if they
yes,
miss that, and if they
yes,
go into peritonitis and shock, they will die.
correct.
So, Parimala, you have really woken up the women. So,
Yes,
and today you are doing the keyhole surgery also. That is so very easy, unlike the
laparoscopic
past.
surgery. Yes,
Yeah, it is so very easy. And hence, being an expert, you have highlighted the importance of detecting the early pregnancy, getting the scanning done in time, and then getting treatment. Because you
yes,
said that there is a treatment, medical treatment also without surgery if they come
correct.
in time.